Welcome back to the Pastest channel. Today we're going to be talking about the Paces Exam, which is the last step in becoming a member of the Royal College of Physicians. The exam is specifically designed to test the knowledge and skills of trainee doctors before they enter higher specialist training. Let's do a deep dive and find out what the exam is all about. The Paces exam is a practical assessment of clinical skills and consists of 5 stations. Each is designed to test different skills such as communication, consultation, and examination. This includes the cardiovascular, respiratory, abdominal, and neurological examinations. The exam sets rigorous standards to ensure that trainee doctors are able to provide the best possible care for their patients. Before the exam, the examiners engage in a process called calibration, where they assess the patients themselves and decide which specific areas need to be covered by the candidate to secure all the marks. It is graded on 7 skills, A to G, with skill B, identifying physical signs, considered to be the most difficult of them all. The key to success in the Paces exam is practice and preparation. It's important to keep your cool and remember that a poor performance in one station doesn't necessarily mean a poor performance in the next. Though it's easier said than done, use the break to focus on the station that's coming up, rather than thinking of what you may have missed in the stations before. In order to improve your chances of success, it's important to focus on the skills that you find most challenging. So let's briefly talk about the different skills that will be tested in the exam. Skill A is physical examination, and it requires candidates to demonstrate good technique when examining the respiratory, neurological, cardiovascular, and abdominal systems. Skill B is identifying physical signs, and this is often considered to be the toughest skill to pass in the exam. It involves identifying physical signs and presenting them logically and clearly to the examiners. Confidence in this skill only comes with practice. Skill C is clinical communication, and this requires you to adequately address the various social and medical factors that are affecting a patient. You need to ensure that you build a rapport and address the patient's needs. Clinical communication skills are tested throughout various stations, so it's important that candidates should practice speaking English and also avoiding medical jargon where possible. Skill D is differential diagnosis. This requires the candidate to interpret the case that's in front of them and suggest appropriate differentials. It's important that you mention the most likely diagnosis first. Skill E is clinical judgment. Having assessed the patient, you should be able to suggest appropriate investigations and discuss a valid management plan. Skill F is managing patients' concerns, so this involves exploring the concerns that the patient may have about their condition or the management plan, giving them time to express their ideas and opinions, and then making sure you address their needs as you see fit. Skill G is maintaining patient welfare, and it examines your ability to treat the patient with dignity and sensitivity. These are just quick summaries of each skill, but it's important to remember that the Paces exam involves putting all of these skills together and demonstrating that you can be a competent and compassionate doctor. If you're preparing for the MRCP Paces exam, it can be difficult to figure out where to start. This is where Pastest comes in. Pastest's MRCP Paces online resource bank consists of over 125 patient cases and over 340 videos. These videos showcase gold standard exam technique, patients with clinical signs, realistic vivas, and feedback from examiners. Pastest doesn't stop there. They've got topic summaries, close-ups of clinical signs, and even heart and lung sounds for you to listen to get you in the zone for your exam. And if you're struggling to nail those clinical signs, the teaching cases and exam mark sheets have got your back. Now let's talk about preparation. Pastest gives you roleplay materials to practice with your friends, case podcasts to listen on the go, and expert tips on each station. Furthermore, you can track all your progress on the dashboard. So if you're looking to breeze through the Paces exam, Pastest should be your go-to resource. In a nutshell, Paces is a crucial step in pursuing a career in medicine in the UK. With the right tools, regular practice, and a solid game plan, you'll have no issues tackling this exam. I hope you found it useful, and if you did, please do like and subscribe, as we've got plenty more videos coming soon. Good luck on your journey to becoming a member of the Royal College of Physicians.